There is growing concern that refugees in this province aren't getting the health care they need. Last June, the federal government dramatically changed the kind of health coverage it provides many refugees. CBC reporter Jennifer Lee is looking into the impact of that decision 10 months later and reveals it's leading to confusion and outright denial of care.
When Henrik Gerber-Macal went to a Calgary refugee clinic a few weeks ago, doctors discovered his blood sugars were dangerously high.
Yes, I'm very sick.
He was sent to an urgent care clinic armed with a referral letter. But Gerber-Macal, who's been diabetic for 8 years, says he couldn't get past admitting. Told he needed to pay up front to see a doctor, he left. He simply couldn't afford it.
When he told me they didn't give me any treatment, I'm very angry. But I can't do nothing. I don't know the system, that's why I can't say anything. I return back to home.
I'm very concerned. I've written the Minister of Health and I've written the Minister of Immigration.
Dr. Coakley says since Ottawa changed health benefits for some refugees and canceled coverage altogether for others, she's seeing several people a month who've been turned away. In one case, she says a 5-year-old girl and her mother left Alberta Children's Hospital without treatment because they were asked to pay up front. The little girl had a broken nose.
How can a child be denied access to health services? How can a child be turned away from care?
Coakley says part of the problem is confusion. No one really knows who's covered and who isn't.
My greatest fear is that there will be a patient death as a result of these changes to interim federal health.
Alberta Health Services says people needing emergency care receive treatment no matter what their health care status. In an email to CBC, a spokesperson says a refugee presenting for a non-emergent service would not be refused care. In the event a service is uninsured in Alberta, the patient would be informed that a fee is associated with the service and they can either pay beforehand or get an invoice later. Nobody is refused care, but fees apply in this situation. In Gerber-Macal's case, he actually had full coverage and a provincial health care number, and still, he says, he couldn't get help. Jennifer Lee, CBC News, Calgary.
The College of Physicians and Surgeons is appealing to doctors to treat these patients. We'll hear more about this tomorrow on CBC News Calgary at 5.